Disadvantages of birth control pills. Heart attack. The chances of birth control pills contributing to a heart attack are small unless you smoke. Studies have shown that smoking dramatically increases the risk of heart attack in women aged 35 years or older, which is why pills are generally not prescribed to women in this age group who smoke. Blood pressure. Women taking birth control pills usually have a small increase in both systolic and diastolic blood pressure, although readings usually remain within the normal range. Blood pressure should be closely monitored for several months after a woman starts taking oral contraceptives, and followed yearly thereafter. Blood clots, venous thromboembolism. Women who use birth control pills are at a slightly increased risk of having a blood clot in the legs or lungs. Studies consistently show that the risk of venous thromboembolism (VTE) is 2 to 6 times higher in oral contraceptive users than in non-users. The risk of blood clots is highest in women with clotting disorders or who have previously had a deep venous thrombosis or pulmonary embolism. Headaches and depression. Headaches may start in women who have not previously had headaches, or can get worse in those who do. Depression, sometimes severe, and other mood changes may occur. This side effect usually goes away after the first few months of use or can be prevented by taking the pill with a meal. Decreased enjoyment of sex. Some women experience a decreased interest in sex or a decreased ability to have orgasms. Not suitable for everyone. Some women should not take pills if they have specific health conditions, including some types of diabetes, liver disease, cardiovascular disease. Women with risk factors for heart disease, such as those with high blood pressure or who are obese, are also at higher risk when on a pill. Diarrhea or vomiting. Anything that makes the pill go through your system too fast can make the pill not work as well because it was not absorbed or, worse, if it is lost in the vomit. Progestogen-only contraceptives may worsen the results of the glucose tolerance test.
Becoming a mother. It's a big step, a big decision. Every day around the world, thousands of women become mothers, supporters, caregivers, and every day, approximately 800 of them die from preventable causes related to pregnancy and childbirth, leaving millions of families motherless. This is what a family looks like with no mother. This is what it looks like when more than 222 million women who wish to plan for pregnancy don't get access to modern contraceptive methods. When they are unable to control the timing and spacing of their pregnancies, mothers die. Sounds hopeless, doesn't it? What if there were a simple, inexpensive, and effective solution? Well, there is one, and with your help, we can achieve it. It's called Family Planning, a voluntary program that gives families the education and tools they need to make the important choices: how many children to have and when to have them, making contraceptive options available to the families who want it, providing high-quality education for families and healthcare professionals in the healthy timing and spacing of pregnancies, voluntary health services, tools, and supplies. Many people have heard of family planning before, but don't know what it really does or who is actually involved. Let's look at the facts and some common misconceptions. Myth: family planning is only a women's issue. Reality: it's an issue for women, men, and families. Myth: family planning programs are about throwing pills at problems. Reality: time and again, women in poor communities rank their access to family planning high on their list of challenges, and improved access to family planning strengthens overall development efforts. Myth: women in developing countries can easily access contraceptives and family planning. Reality: women often have to travel long distances, sometimes many miles on foot, to get their health needs met. Myth: family planning programs are coercive. Reality: family planning programs are always voluntary. Women and men choose to use a family planning method based on their needs. With family planning, we can cut maternal deaths by more than 2/3, reduce newborn deaths by more than half, lower unintended pregnancies by more than 2/3. So, how does this all add up? Longer lives, smaller families, and higher incomes. Healthier and happier families with the economic stability to send their children to good schools, buy them clothes, and feed them nutritious meals. Healthier women mean healthier families. Healthier families mean healthier communities, and in turn, a healthier world. Today, more than 200 million women wish to determine the timing and spacing of their pregnancies, but do not have access to family planning. With greater investments, we can improve access for all women, building healthier families and communities. With your support, we can provide more tools, more education. We can help more families. Join us in delivering lasting change. Get involved and reach out to your member of Congress to have them support international family planning. This is what a family looks like with a mother. Let's keep it that way.